I will get straight to the point, because at 97 years old, you stop wasting time with polite introductions. Type 2 diabetes is not only about sugar, it is about the way the body handles energy, and for many people, the way they eat every day slowly pushes that system into failure. I have watched this happen to friends, neighbors, and even members of my own family. And I have also seen something else. People change what they eat, and the disease begins to loosen its grip. Now, let me be clear about something important. Diet is not magic, and it is not a miracle cure. But diet can change the biology of the body in ways that medicine alone often cannot. When the right foods replace the wrong ones, insulin begins to work better, blood sugar becomes more stable, and in some cases people move from diabetic levels back toward normal metabolic health. That is why scientists and doctors around the world have spent decades studying which dietary patterns actually help reverse type 2 diabetes. The question is not whether food matters. That question was settled long ago. The real question is this: which diets truly work best? Over the years, I have studied and observed several approaches that appear again and again in research and in real life. Some people improve dramatically on a whole food plant-based diet rich in fiber and natural carbohydrates. Others see rapid improvements when they reduce carbohydrates and lower the demand for insulin. There are also Mediterranean patterns, high-fiber strategies, and controlled calorie approaches that have helped many people regain metabolic control. Each of these diets works through different mechanisms inside the body, reducing insulin resistance, lowering liver fat, stabilizing blood sugar, and restoring metabolic balance. But not every diet works the same way for every person, and that is exactly what we must understand. Before anyone claims that one diet is the answer for everyone, we must look carefully at what the science, the doctors, and real human experience actually show. The first thing I learned after decades of watching people struggle with type 2 diabetes is that the disease is not simply about eating sugar. That is the great misunderstanding that traps so many people. Type 2 diabetes is primarily a disease of insulin resistance, a condition in which the body's cells gradually stop responding properly to insulin, the hormone responsible for moving glucose out of the bloodstream and into the cells where it can be used for energy. When insulin resistance develops, the body must produce more and more insulin just to keep blood sugar under control. For years, this process can remain hidden. The pancreas works harder, insulin levels rise, and eventually the system begins to fail. Blood sugar rises, doctors diagnose diabetes, and medications are introduced. But here is the critical point many people never hear clearly enough. Dietary patterns strongly influence insulin resistance. What we eat daily affects body fat distribution, liver fat accumulation, inflammation, and the way cells respond to insulin. Over time, certain dietary patterns can worsen insulin resistance, while others can gradually improve it. This is why different diets have been studied as potential tools to reverse type 2 diabetes. One of the most widely studied approaches is the whole food plant-based diet. This dietary pattern emphasizes vegetables, legumes, whole grains, fruits, and other plant foods while minimizing processed foods and animal products. Researchers studying populations that consume high-fiber plant diets have repeatedly observed lower rates of type 2 diabetes. The reason appears to be partly metabolic. Whole plant foods are rich in fiber, which slows the absorption of glucose into the bloodstream. This prevents sharp spikes in blood sugar and reduces the demand for insulin. Over time, reduced insulin demand may improve insulin sensitivity. Plant-based diets also tend to lower calorie density. Foods such as vegetables, beans, and whole grains provide nutrients and volume without excessive calories. As body weight gradually decreases, insulin sensitivity often improves as well. Several clinical trials have demonstrated that individuals with type 2 diabetes who adopt high-fiber plant-based diets often experience reductions in HbA1c levels, which is one of the most important long-term markers of blood glucose control. However, the plant-based approach is not the only dietary strategy that has shown positive results. Another widely discussed approach is the low-carbohydrate diet. This strategy takes a very different path toward the same goal. Instead of increasing complex carbohydrates and fiber, the low-carb approach significantly reduces carbohydrate intake in order to reduce the amount of glucose entering the bloodstream. When carbohydrate intake is lowered, blood sugar fluctuations often become smaller and more predictable. Because fewer carbohydrates are consumed, the body requires less insulin to manage blood glucose. For some individuals, this reduction in insulin demand leads to rapid improvements in blood sugar control. Many people following low-carbohydrate diets report that their fasting blood glucose levels improve within weeks. In some cases, medication requirements decrease under medical supervision. Researchers studying low-carbohydrate interventions have found that they can lead to improvements in HbA1c, weight reduction, and improved metabolic markers. Some clinical programs designed around carbohydrate restriction have reported significant diabetes remission rates when patients follow the diet consistently. However, this approach also has limitations. Long-term adherence can be difficult for some individuals, and not everyone responds equally to carbohydrate restriction. For that reason, it is often considered one option among several rather than a universal solution. A third dietary pattern frequently studied for metabolic health is the Mediterranean diet. Unlike the previous two strategies, the Mediterranean pattern is not built around extreme restriction. Instead, it focuses on overall dietary quality. This approach emphasizes vegetables, fruits, legumes, whole grains, olive oil, nuts, fish, and moderate portions of other foods. One of the strengths of the Mediterranean diet is its balance of healthy fats, fiber, and minimally processed foods. Olive oil and nuts provide monounsaturated fats that may support cardiovascular health, while plant foods provide fiber and antioxidants that help regulate blood sugar. Large population studies and randomized clinical trials have shown that the Mediterranean diet is associated with lower rates of type 2 diabetes and improved blood glucose control among individuals already diagnosed with the disease. Some researchers believe the effectiveness of the Mediterranean diet comes from several combined mechanisms. These include improved insulin sensitivity, reduced inflammation, and better overall metabolic stability. Then there is another strategy that receives less public attention, but has shown striking results in scientific research. Calorie-restricted weight loss diets designed to reduce liver fat and pancreatic fat. Scientists studying diabetes remission have discovered that excess fat accumulation in the liver and pancreas may interfere with normal insulin signaling. When these organs accumulate too much fat, Their ability to regulate blood glucose becomes impaired. Clinical programs using structured calorie reduction have demonstrated that significant weight loss can reduce fat inside these organs. As liver fat decreases, insulin sensitivity improves. As pancreatic fat decreases, insulin production can partially recover. In several studies, individuals who lost substantial weight through medically supervised dietary programs experienced remission of type 2 diabetes, sometimes within months. What is important here is not that one specific diet always works better than another. The deeper lesson is that multiple dietary pathways can improve the underlying metabolic dysfunction of type 2 diabetes. Some diets improve insulin sensitivity through fiber and plant foods. Some reduce blood glucose load through carbohydrate restriction. Others reduce organ fat through weight loss. Different mechanisms, but often similar outcomes. And this brings us to a crucial realization that took me many years to understand. The success of any diabetes-reversing diet depends not only on its biological mechanisms, but also on whether a person can sustain it for years. A diet that works perfectly in theory but cannot be maintained in real life rarely produces lasting health. That is why researchers increasingly focus not only on metabolic outcomes, but also on long-term adherence. The most effective dietary pattern is often the one a person can follow consistently while maintaining balanced nutrition. Over time, the body begins to adapt. Blood sugar stabilizes. Insulin sensitivity improves. Weight often declines. And in some cases, individuals who once required medication find themselves managing their condition primarily through lifestyle. But understanding which diet works is only part of the story. To truly understand how dietary patterns influence diabetes reversal, we must look deeper into the biological mechanisms happening inside the body, how insulin resistance develops, how fat accumulates in the liver and pancreas, and how certain foods can gradually restore metabolic balance. Those mechanisms explain why some people experience remarkable improvements when they change their diet, while others struggle until they find the dietary pattern that fits their metabolism and their life. And that is exactly what I want to explain next. Now let me take you a little deeper into what is actually happening inside the body, because understanding the biology explains why these diets can sometimes do what medications alone struggle to accomplish. For many years, doctors believed type 2 diabetes was mainly a progressive disease. The common assumption was simple. Once diagnosed, the condition would gradually worsen over time. Blood sugar would rise, medications would increase, and eventually insulin therapy would become necessary. But over the last 2 decades, research has revealed something important. In many cases, the metabolic damage driving type 2 diabetes is not permanent. It is often linked to reversible physiological changes, particularly those involving insulin resistance and fat accumulation in critical organs. To understand this, imagine the body as a system designed to handle glucose efficiently. Every time we eat carbohydrates, glucose enters the bloodstream. Insulin then signals cells to absorb that glucose and use it for energy. But when a person develops insulin resistance, the cells stop responding properly to that signal. The pancreas compensates by producing more insulin. This can continue for years until the system becomes overwhelmed. One of the major discoveries in metabolic research is that excess fat stored in the liver plays a major role in this process. When the liver accumulates fat, it begins releasing glucose into the bloodstream even when it is not needed. This increases fasting blood sugar levels and forces the pancreas to produce even more insulin. At the same time, fat can also accumulate in the pancreas itself. This interferes with the beta cells that produce insulin, gradually reducing their ability to respond properly. When both of these processes occur together, liver fat increasing glucose output and pancreatic fat impairing insulin production, the metabolic system begins to fail. Blood sugar rises and type 2 diabetes develops. Now here is where diet becomes extremely powerful. Certain dietary changes can gradually reverse these processes. When calorie intake is reduced and body weight begins to fall, the body starts mobilizing stored fat. The liver often loses fat first. As liver fat decreases, the liver becomes more responsive to insulin and stops releasing excessive glucose. This alone can significantly reduce fasting blood sugar. Then, as further weight loss occurs, fat inside the pancreas may also decline. In some individuals, this allows pancreatic beta cells to regain part of their insulin-producing capacity. This is why some people who lose substantial weight through structured dietary programs see dramatic improvements in blood sugar control. But weight loss is not the only pathway. Dietary composition also plays a role in how the body handles glucose and insulin. For example, high-fiber foods slow the absorption of carbohydrates. When glucose enters the bloodstream more gradually, insulin does not need to spike dramatically. Over time, this can help restore more stable metabolic regulation. Fiber also feeds beneficial gut bacteria. These microorganisms produce short-chain fatty acids that may improve insulin sensitivity and reduce inflammation. Another important factor is glycemic load. Foods that rapidly raise blood sugar force the body to produce large bursts of insulin. Repeated spikes over many years may contribute to worsening insulin resistance. Diets that emphasize low glycemic foods, such as legumes, vegetables, whole grains, and minimally processed carbohydrates, tend to produce more stable blood glucose responses. On the other hand, low-carbohydrate diets reduce the glucose entering the bloodstream in the first place. With fewer carbohydrates to process, the body requires less insulin. For some individuals, this can rapidly stabilize blood sugar levels. What is fascinating is that these two very different strategies, high-fiber plant diets and low-carbohydrate diets, can both lead to improvements in diabetes markers, even though they operate through different mechanisms. One emphasizes improving insulin sensitivity through fiber and plant nutrients. The other emphasizes reducing the demand placed on the insulin system. Both approaches aim to restore metabolic balance. And then there is the Mediterranean dietary pattern, which seems to work through a combination of several beneficial mechanisms. Olive oil, nuts, fish, vegetables, and legumes provide a balance of healthy fats, fiber, and antioxidants. These nutrients appear to reduce inflammation, improve lipid profiles, and support insulin function. When researchers examine populations that follow Mediterranean-style diets, they consistently observe lower rates of metabolic disease and better cardiovascular health. But here is something I have noticed during my long life observing people and their habits. The most successful individuals are not the ones who follow a diet perfectly for a few months. They are the ones who build a sustainable lifestyle around the principles of metabolic health. They learn which foods keep their blood sugar stable. They reduce ultra-processed foods that disrupt metabolic regulation. They prioritize whole foods, balanced meals, and consistent eating patterns. Over time, these habits reshape the body's internal chemistry. Insulin resistance decreases, blood sugar stabilizes, energy levels improve, and sometimes, under medical supervision, medication requirements decrease. But honesty demands that we say something else as well. Dietary reversal of type 2 diabetes does not happen in every case. Some individuals have lived with the disease for many years, and pancreatic damage may be too advanced to fully restore insulin production. Others may have genetic predispositions that make metabolic recovery more difficult. That is why responsible discussions of diabetes reversal always emphasize medical supervision, realistic expectations, and individualized treatment. Diet can be powerful, but it is not a miracle cure. Still, the evidence accumulated over the past 20 years has changed the way many scientists and physicians view type 2 diabetes. Instead of seeing it purely as an irreversible condition, many now recognize it as a metabolic disease that can sometimes be significantly improved or even placed into remission through dietary and lifestyle interventions. And that realization has given hope to millions of people who once believed their condition could only worsen with time. I have lived long enough to see medical ideas change, and this shift in understanding is one of the most important developments in modern nutrition science. Food is not simply fuel, it is information for the body. It signals how our metabolism should behave, how our hormones respond, and how our cells manage energy. When the signals improve, the body often begins to repair itself. And that brings me to the final lesson I want to leave you with. The practical wisdom that matters most when someone is trying to protect their metabolic health or reclaim it after diabetes has already begun. After nearly a century of watching people live, struggle with illness, and sometimes regain their health, I have come to understand one simple truth. The body is more adaptable than we once believed. Type 2 diabetes, in many cases, develops slowly through years of metabolic strain, but that same system can often respond when the conditions change. What we have learned from science, from doctors, and from real human experience is that diet plays a powerful role in shaping those conditions. Certain dietary patterns, whole food plant-based eating, carbohydrate reduction, Mediterranean-style diets, and structured calorie control have all shown the ability to improve insulin sensitivity, stabilize blood sugar, and in some cases move people toward remission of type 2 diabetes. But the lesson is not that one diet is perfect for everyone. The real lesson is that diets that work tend to share several important principles. They reduce highly processed foods that overwhelm the body's metabolic systems. They focus on whole foods that the body can process more gradually. They help lower excess body fat, particularly fat stored in the liver and pancreas, which plays a central role in insulin resistance. Over time, these changes allow the body's metabolic machinery to begin functioning more normally again. Still, wisdom requires honesty. Diet can help reverse type 2 diabetes in some people, but not in every case. The condition is complex, and successful management often requires medical guidance, lifestyle changes, and long-term commitment. Yet there is reason for hope. The growing body of research shows that type 2 diabetes is not always a one-way road. For many individuals, meaningful improvement is possible. Blood sugar can stabilize. Medication needs may decline. Health can improve. At 97 years old, I have learned that the most powerful medicine is often the quiet discipline of daily habits. And among those habits, few are as important as the food we choose to place on our plate every single day.